Have you ever stopped to think about how doctors can actually see inside the tiny, complex arteries and veins that keep us all going? Well, today we're going to talk about this incredible technology that lets them do exactly that. It's called Intravascular Ultrasound, or IVUS for short, and it has totally changed the game by giving us a view of our own bodies from the inside out. So let's start with a simple analogy. Imagine you're trying to fix the plumbing in a house, but you have no idea what the inside of the pipes looks like. Is it a clog? Is the pipe wall damaged? You're basically working blind. Well, that's pretty much the challenge doctors have been up against with our blood vessels. So the big question is, how do you make a critical, life-saving repair when you can't really see what you're doing? For a long time, the best tool we had was something called angiography. And honestly, it's kind of like looking at a shadow puppet on the wall. You see the outline, the silhouette of the blood flow, but that's it. It doesn't tell you anything about the vessel wall, what the plaque is made of, or how big the blockage really is. But IVUS, that's like putting a tiny 360-degree camera right inside the pipe. You see everything. The difference is, well, it's literally night and day. Okay, so this idea of an ultrasound on a wire, how does it actually work? Let's get into the nuts and bolts of the technology that makes this amazing insight view a reality. You know, the core concept is actually pretty straightforward. IVUS is what's called a catheter-based system. So you've got this super thin, flexible tube that's guided into a blood vessel. But here's the magic. On the very tip of that catheter, there's a teeny tiny ultrasound probe. It sends out high-frequency sound waves, just like a regular ultrasound, to build a live, cross-sectional picture from inside the vessel itself. The whole process really breaks down into 3 simple steps. First, the catheter is carefully guided right to the spot the doctors need to see. Once it's in place, that little transducer starts sending out sound waves in a full circle. Those waves bounce off the artery walls, any plaque, whatever's in there, and then they come back. And a computer instantly puts all those echoes together to create that detailed 360-degree image on the screen. But, this isn't a one-size-fits-all kind of deal. There's this really important trade-off between how detailed the picture is and how deep the sound waves can go. So for those tiny little coronary arteries around the heart, doctors use a really high-frequency probe. It gives you incredible resolution. For bigger vessels, say in the legs, a medium frequency is the sweet spot. And for something huge like the aorta, you need a lower frequency that can penetrate all the way through the thick wall. It's all about picking the right tool for the job. So, we've got the tech down, but this is where it gets really interesting. How does having this inside view actually change things for patients? Let's look at some real-world situations where IVUS is an absolute game changer. All right, picture this. A patient gets a stent to open up a blocked artery. It's one of the most common procedures out there. The surgeon places it, looks at the angiogram, the shadow picture, and everything looks great. But one study found that in a staggering 40% of those cases, the stent wasn't fully opened and pressed against the artery wall. And here's the kicker. That problem, that underexpansion, which is a huge risk for another blockage down the road, was totally invisible on the standard angiogram. But with IVUS, a doctor sees it immediately. They can see the gap and fix it right then and there, maybe by using a slightly bigger balloon. That one little check can literally prevent a patient from having to come back for a whole other procedure. Now, let's really raise the stakes. There's a terrifying condition called an aortic dissection. It's where the inner wall of the aorta tears and blood starts flowing between the layers of the wall, creating 2 paths. One is the right way, the true lumen. The other is a dangerous dead end, the false lumen. For a surgeon trying to fix this, it comes down to a life or death choice. Which path is the right one? If you guide the wire into the true lumen, you're on your way to saving a life. But if you accidentally go into the false lumen, well, that can be catastrophic. On a flat 2D angiogram, telling them apart is incredibly tricky. But with IVUS, the surgeon can see the thin little flap of tissue that separates the two. It gives them absolute certainty, making sure they stay on the right path. And hey, these benefits aren't just one-off stories. They show up in the hard data year after year. Take this study on treating blocked arteries in the leg. When doctors only used angiography, just 35% of those arteries were still open 5 years later. But when they used IVUS to guide the procedure, that number nearly doubled, jumping all the way to 65%. I mean, that's a massive, massive improvement in long-term success for patients. So it's pretty obvious that being able to see from the inside is a huge advantage. Let's just quickly wrap up with the biggest benefits and take a quick peek at where all this is going next. When you add it all up, it's a win-win for everyone. For patients, using IVUS means less radiation and less of that contrast dye that can be tough on the kidneys. For doctors, it means they can size stents perfectly, confirm their work was a success right on the spot, and, as we just saw, give their patients much, much better long-term results, which of course means fewer people needing to come back for a do-over. And of course, the technology is not standing still. The future seems to be all about combination devices. We're talking about new catheters that have IVUS built right in alongside other sensors. Imagine being able not just to see the structure of a blockage, but to actually analyze what the plaque is made of, to know if it's the stable kind or the dangerous kind that's likely to cause a heart attack. That's where we're heading. It's truly incredible when you think about it. IVUS has taken vascular medicine from working with shadows to operating with a live, high-def picture from inside the human body. And it just makes you wonder, right? Now that we can see inside ourselves with this kind of clarity, what's the next frontier? What's the next impossible view that we're going to make possible?